Let's take a look at the spine and what a normal spine should look like. The spine is made up of 3 segments: the neck, the mid-upper back, and the lower back. When viewed from the side, these segments form 3 natural curves. The inward curves of the neck and lower back are called lordosis. The outward curve of the chest is called kyphosis. These curves are important to maintain our balance, and they help us to stand upright. Now that we understand what the bone should look like when normally aligned, now let's take a look at an actual person's posture from the side and to try to identify these 3 main curves. Look closely at the neck region. Do you see an inward curve? Now let's move down to the mid-upper back. What direction is the curve? That's right, outward. Look now at the low back. Can you see this curve? Can you tell that it's turning inward just like the neck? Good work. In addition to looking at the natural curves of the spine when we're doing a posture assessment, we should be looking at several other areas. Let's look at the same picture of a person. Again, looking at him from the side, let's examine other signs of good posture. Here, notice his head is upright. We can tell that because his eyes point straight forward and his chin is parallel to the floor. Also, his ear, shoulder, and hip all line up along the red line that is pictured. Let's compare this picture of good posture to one that shows bad or poor posture. What is different between these 2 pictures? In the second picture, the man's head is positioned forward. In order to keep his eyes level, note that his head is tilted back, causing an increase in the amount of inward curve at the neck. The shoulders are rounded, which result in an increase in the outward curve at the mid to upper back. Finally, his pelvis is tilted backwards, which decreases the inward curve at the low back. Now look at the red line that is pictured. How do the ear, shoulder, and hip line up compared to the red line? That's right, they don't line up on the red line. Now that we have compared good posture versus poor posture, let's take a look at some of the other deformities of the spine. Number 1, what do you see in this first picture? Here, there's a decreased outward curve of the mid-upper back and decreased inward curve of the low back, causing the spine to appear flat. 2, let's look at the next picture. What do you see now? This is the opposite of the picture we just looked at. Here, the outward curve of the mid-upper back is increased, and the inward curve of the low back is increased. 3, here we can see that the curves of the neck and mid-upper back are normal. However, there is an increased curve of the low back. 4, moving on to the next picture, how does this one compare to normal posture? That's right, there is an increased outward curve of the mid-upper back. With this type of deformity, it appears that the person has a hunchback. There are 4 main causes that can be attributed to causing this type of deformity. The first is osteoporosis, which is a disease of the bones in which they become brittle and weak. This can lead to the bones of the spine compressing and collapsing on one another. Another cause of this hunchback deformity can be due to congenital deformity in which a patient is born with a rounded spine at birth. Sometimes there can be a progressive rounding of the spine of an unknown cause. It may be attributed to forward posture work or position that promotes a forward lean, such as working over a computer for long hours each day. Typically, when this is the case, there will be weakness in the muscles along the back of the spine and weakness of the muscles that support the shoulder blades that promote good posture. Due to this deformity, the muscles across the front of the chest become tight, and the muscles of the mid-back straight in the spine become weak. The main symptoms individuals with this deformity will experience include back pain that can vary from mild to severe. Their overall height will decrease due to the collapsing or shrinking of the spine. Patients will often report fatigue with tiredness in the postural muscles with activities which require the patient to sit or stand for long periods of time. Often, patient will report the symptoms will increase as the day goes on. Finally, when the outward curve of the mid-upper back gets so severe, this can lead to difficulty breathing due to the rib cage limiting the ability to fully fill the lungs with air. Therapy can play a very important role to address the problems created by the increased outward curve of the mid-back or hunchback posture. Modalities such as electric stimulation and diathermy may be helpful to address pain symptoms. Modalities may also be beneficial to heat up tight muscles, to increase the motion, and stimulate the weak muscles for improved strength. Significant focus will be on stretching the structures of the front of the body that are tight while strengthening the muscles on the back of the body and spine that are weak. Muscles that we should focus on stretching would include those on front of the chest, shoulder, neck, hip, and abdominals. Due to the forward bent postures, these muscles become tighter, further contributing to poor posture. We also want to use manual therapy using our hands to physically decrease the tightness in the muscles on the front of the body and increase the soft tissue mobility of the muscles that support the spine. Strengthening exercises would focus on the muscles that straighten the spine and back upright. This would also include exercises to straighten the mid-back, pull the shoulders and head back out of the forward position. Can you remember any exercises that we did for the shoulder that focused on posture? If you said shoulder blade squeezes, then you'd be right. Another important exercise to teach your patient would be one in which they attempt to pull their head straight back out of the forward position while keeping their eyes and jaw level. Another key part of therapy intervention would revolve around posture education and positioning. We need to provide education to avoid positions that can cause a prolonged forward posture. What types of activities do you think would promote a forward posture? These may include activities such as sitting and reading, desk work, or standing counter height activities such as cooking a big meal. We also need to look closely at sleeping positions, driving positions, and the setup of the workstation to make recommendations for modifications to promote an improved upright posture. 5. Let's move on and look at another postural deformity. Now we are looking at the spine from the back. What do you see? Here the spine bends sideways. This is known as scoliosis. The image on the right shows a right scoliosis. Notice the spine bends towards the right side. The image on the left shows a left scoliosis. Here the spine bends towards the left side. Number 6. With this next image, we can see that the inward curve of the neck is increased as compared to normal. This is also referred to as forward head posture. This abnormal posture is caused by tightness of the muscles at the back of the neck, just below the skull, as well as large muscles that is positioned on the side of the neck. There can also be changes in the positioning of the bones in the spine, causing them to tip backwards, as well as a deterioration of the cushion that exists between the bones of the neck. Due to the abnormal posture, the patient will normally compensate by bending back the upper portion of their neck in order to keep their eyes level. Other symptoms will include decreased motion at the neck and shoulders. Pain, stiffness, and headache are also common complaints. Patients may experience difficulty with pain or abnormal function of the jaw where it joins the skull just in front of the ear. Pain may also be felt when sleeping or sitting for long periods of time. Therapy treatments for this postural abnormality would include the following. Stretching of the tight muscles. This includes muscles along the back and the side of the neck. We would focus on stretching tight muscles across the front of the shoulders and the chest. Postural strengthening exercises. These exercises would focus on the muscles that would help to straighten the spine and promote an upright posture. This would include muscles along the mid-back and neck. Examples would include chin tucks and rowing. Functional activities such as overhead reaching would also be beneficial to promote an upright posture and strengthening of these muscles. Manual therapy techniques in which we use our hands to improve mobility of the soft tissues and provide passive stretching. Use of physical agent modalities such as diathermy, ultrasound, moist hot pack, and electrical stimulation. The goals related to using these modalities would include decreasing soft tissue tightness and decreasing pain. Patient education and feedback regarding abnormal postures. It is extremely important that we provide education to the patient on the posture that will contribute to forward head and rounded positions. And 7. The final spinal abnormality we'll look at is now pictured. How does this compare to what we just looked at with the forward head position? Here we see a decrease in inward curve of the neck, giving a neck a flattened appearance when looking at it from the side. This deviation can be caused by spasms of the muscles in the back of the neck, trauma, or arthritic changes. The symptoms associated with the problems include decreased motion of the neck. We will also see tightness in the muscles in the back and the sides of the neck. The treatment we would provide would be very similar to what we just discussed for the previous condition. We would want to address pain with the use of modalities and manual techniques as appropriate. We would want to restore motion of the neck by stretching any tight muscles and strengthening any weak muscles. Exercises would emphasize a good posture and would include chin tucks, bending the mid-back and neck backwards, rowing, overhead reaching, and functional activities. It is important to understand what is considered a normal or good posture so that we can determine when someone falls outside this and presents with a poor or abnormal posture. Can you identify normal or good versus abnormal or poor postures?